Heart failure and cancer seems to be unfortunately, two common themes on the channel here. So, hey, why not just continue to try to make people healthier and add to the growing list of supplements, herbs, and nutrients and vitamins that we break down on the channel? Seven specific herbs and supplements are great to keeping the old ticker a-ticking. Magnesium is found in many foods and is critical for hundreds of enzyme systems and maintaining healthy blood pressure. Congestive heart failure is a disease with a misleading name, and it doesn't mean that your heart stopped beating. Rather, heart failure is a chronic condition that occurs when the heart muscle can't pump enough blood to the body, causing an increased amount of damage as organs and tissues are deprived of oxygen and nutrients carried to the blood. Heart failure doesn't develop overnight. It develops gradually and is often the result of an underlying health condition that weakens the heart, such as heart disease, obesity, and high blood pressure. Good news is you can avoid the diagnosis of congestive heart failure by making heart-healthy choices, such as losing weight, exercising regularly, and incorporating important organic produce and healthy fats into your diet. And these 7 herbs and supplements. You see the first one that's down there, coenzyme Q10. We've talked about it. I think it's got a specific video on the channel, but it's really, really, really great for your heart. And it's even better at making sure that you don't be getting any of that heart failure. The efficacy of coenzyme Q10 or CoQ10, is a matter of controversy among scientists. A 2017 meta-analysis of clinical trials sought to gain clarity on the question by pooling together the results of previous studies evaluating the effects of using coenzyme Q10 to treat patients with heart failure. Researchers combined PubMed and other top medical databases for controlled trials of CoQ10, with 14 trials and 2,149 heart failure patients meeting inclusion criteria. Endpoints for the trial were death, left heart ejection fraction. I thought it said fraxation. That's not a word. A measure of the left ventricle's ability to pump blood. That's the one that pumps. In order to get blood through your system, the right side is the receptacle that reoxygenates the blood and sends it into the lungs, to receive and undergo that oxygenation process. So that's why that one's specific. Exercise capacity and standardized measure of overall heart function after treatment. Final analysis showed that patients with heart failure who were supplemented with CoQ10 had a lower death rate and higher exercise capacity than placebo-treated patients. Other studies support CoQ10's ability to help patients with heart failure decrease serious complications and avoid hospitalization. Significant findings were also attributed to CoQ10's ability to support mitochondrial function and provide energy to cells. Ubiquinone, that's weird. Oh, good, they got pronunciations there. Maybe they've seen my butchering of the English language. Oh, it's more medical terminology than anything. Is a recently developed form of CoQ10 that had been commercially available for about 12 years. Never heard of it before. Considered the active form of CoQ10, ubiquinol is an antioxidant that plays a key role in treating creating cellular energy. CoQ10 comes in 2 forms, ubiquinone and ubiquinol, both of which are made naturally in the body. The body must convert ubiquinone to ubiquinol to create cellular energy. But what about ubiquitous? Is that the final form of it? Clinical trial on patients with congestive heart failure noted that patients who were given supplemental ubiquinone at doses of up to 900 milligrams per day failed to achieve adequate blood plasma levels of CoQ10. Researchers postulate that intestinal edema is these critically ill patients had prevented their bodies from being able to adequately convert the ubiquinone to active ubiquinol. Oh, cool. So if you just supplement with the ubiquinol, if your body is too ill to create its own ubiquinone from the CoQ10, there you can supplement, and there you can kind of subvert your body's inability to fulfill that biological function until a time arises where you can perform that basal task. Interesting. 2019 study supports these findings. On 400 milligrams of ubiquinol per day for 3 months, patients with heart failure and reduced ejection fraction had significant improvement in peripheral endothelial function when compared with placebo-treated patients. All right, so omega-3 and omega-6, interesting. Dem fats. The importance of including healthy fats in your diet has gained needed attention since the flawed logic of low-fat diets has been exposed. Yeah, imagine that. Eating a whole bunch of sugar and refined carbohydrates is the worst thing you can do. Following the old food pyramid was the worst thing, okay? The blight of, I guess, big wheat that's out there. The Farmers Agricultural Co-op that ended up funding the standardized food pyramid that recommended, 6 to 12 servings of grain a day. Yeah, exactly. They were just trying to help their bottom line at the detriment of healthy individuals everywhere. Anyways, as it turns out, your brain and heart need fat to function. Yep, exactly. And your body can create the glucose it needs from the fat that you consume within your body, and you need less fat by size and volume, not from mere energy levels, this is, of course, as opposed to carbohydrate intake. As it turns out, your brain... it is important to choose the right kind of fats, including heart-healthy, polyunsaturated, words are hard sometimes, fatty acids like omega-3s and certain omega-6s, yes. Well, most people consume an overabundance of omega-6 fats from processed foods. A study published in the journal Lipids in Health and Disease found that low levels of dihomo gamma linoleic acid, DGLA, and omega-6 PUFA, polyunsaturated fatty acids, that's what that stands for, circulating in the blood were associated with higher death rates in patients with heart failure. Conversely, higher levels of DGLA in the blood were associated with higher survival rates. Sweet. And omega-3s, we've been over those ad nauseum. So what the hell is Hawthorn? Hawthorn is a plant. Oh, thanks. Cool. I didn't think the name was too descriptive. Anyways, in the rose family. But by any other name, it would still be a herb that will help your heart. Native in cooler northern hemisphere. Hawthorn's scientific name, Crataegus. All right. Sounds like a Greek philosopher. Has been used to make traditional medicines for hundreds or thousands or millions of years, and most commonly applied to the treatment of heart disease. In an effort to substantiate centuries of use, the European Journal of Heart Failure published a study on the efficacy and safety of hawthorn extract in patients with heart failure, naming the study the SPICE trial. Researchers performed a large-scale mortality trial encompassing 1,442 patients with congestive heart failure. Supplementing with hawthorn was found to reduce sudden cardiac death by a whopping 39.7% at month 24 of the treatment in patients with less comprised left ventricular function. Well, that's pretty amazing. With the treatment also showed no significant adverse effects. Cool, sweet. So there seems like there's no downside by supplementing, cooking, or adding in hawthorn. Don't know what its palate is, but you know, if you can find a way to work it in, why not? Berberine. What the heck is that? Is another plant-based medicine that is demonstrated impressive heart benefits, anecdotally believed to aid in producing stronger heartbeats. Berberine, place in our herbal pantheon, as a heart healer, has received scientific validation. In 2010, a berberine derivative was found to strengthen the heart by blocking calcium influx. Aha! A central cause of a failing heart, yes, and exerting powerful antioxidant activity. Among berberine's heart-boosting properties is anti-arrhythmic heart palpitations activity, and has been shown to prolong the duration of ventricular action potential. In other words, it creates a stronger, more rhythmic heartbeat. So it looks like the old wives' tale has been proven true. And then take a look at that. Magnesium, something that we focused on specifically in a video from not too long ago. Because we talk about it so much, I mistakenly thought there was already a video on the topic. But yeah, no, one's dedicated from a couple weeks back at this point. So yeah, we'll just gloss over this. The mineral salt magnesium is critical in more than 300 enzyme systems in the body, as well as regulation of blood pressure. Yeah, as you know, One study published in the Journal of Congestive Heart Failure found that the oral supplement with 800 milligrams per day of magnesium oxide from 3 months produced improved arterial function when compared to placebos in heart failure patients. It's amazing. If you're cramping, if you're, your old ticker's running low, magnesium, it'll help you out. Don't worry about it. It's great. It's one of the essential electrolytes that are out there. Arginine. All right, an amino acid, arginine, also called L-arginine. Thanks, Tips. Is important for numerous bodily functions, including dilating and relaxing arteries. Seems pretty important if you're talking about heart health, right? Through arginine is produced endogenously. There we go. It needs to be consumed to maintain adequate levels. Yes, you need to get it from the healthy cuts of meat and animal byproducts as well, okay? Arginine's role in healthy heart function has been the focus of numerous studies in recent decades. Supplementation for 6 weeks was found to enhance exercise tolerance in heart failure patients. Cool. Meta-analysis of more than 30 years worth of scientific studies on arginine found that oral supplementation exerts favorable effects in the prevention and treatment of a vast array of cardiovascular disorders, including mild to moderate heart failure. Before starting any herb or supplement regimen, it's important to talk to your healthcare provider about possible contraindications with a current medication or prescribed treatment protocols. Yeah, of course, because how are you going to know specifically, okay, unless it's gotten to a degree where it's become noticeable, but you're not really all that sure about your heart health, okay? There's very few tertiary indicators as to how healthy it is. So, yeah, of course, get your doctor to take a look at the old ticker, because it's, in case you didn't know, it's pretty important to be keeping you around, and I want to see you around for as long as humanly possible. With all of that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.